Good morning, I'm Ellen Leahy. I'm the health officer and the director of the Missoula County Health Department. I'm doing this update Monday, May 11th. Incident Commander Cindy Farr is off on a respite day. Over the last 3 days, Montana has gotten 3 new COVID-19 cases. None of those are in Missoula County. In Missoula County, we currently have no active cases, no new cases, and we actually no longer have anyone in quarantine. I'd like to do a little reminder of what is open, what will be open, and answer some of the questions that we've been getting most frequently. There's no longer an essential versus non-essential retail establishments. I know that we still get a lot of questions about that, but the essential versus non-essential designation is not in play anymore, and it hasn't been since the governor reopened the stay-at-home order on April 22nd. So most retails have been open for some time, and then of course the ones that were open during the shutdown. We are still getting questions and concerns and sometimes complaints about some of those retail operations not having good control over 6-foot distancing. The requirement for retail is to have a plan that shows how they were describes how 6-foot distancing will be maintained, and also have visible markers, whether it's barriers, tape on the floor, whatever, to help with that. So those are the types of things that we're still hearing about. Restaurants and bars have been able to be open at half capacity since the 4th, and that half capacity includes having the tables like every other table, so that people can't parties can't sit, or when they're moving around, be closer than 6 feet, and then no standing or service at counters. All of the folks working in the restaurant and bar have to have a mask, and customers are to come and leave with a mask. Obviously you can't eat and drink with one, but mask when you're just sitting around and talking. Going back to retail, one of the complaints we get is, even though retail is not required to have masking, we do get complaints from people that go into a store and they find that the checkers are not wearing a mask, and they generally don't feel comfortable with that when we get the call. Salons, massage, body art, estheticians, barbers, all of those activities can open today if they have their plan in place, and the plan has to show how they are going to maintain all of the distancing and sanitation requirements that we issued last week. The format for that plan can be found out online at our COVID Missoula County website. We suggest that you don't walk to your salon or drive to your salon or your barber shop, that you call first, and each salon is able to determine what additional safety steps they wish to take in additional above what the requirements are. So get on their website or give them a call. And masking, of course, is required in those businesses. Farmers markets will be able to open on Saturday, May 23rd. They are also required to have a plan with us approved by the health department in advance. You will have heard that 250 people maximum can be in that space of a farmer's market at any time. And while that's accurate, that is not a goal. The 250 is the maximum at any given time. What really determines how many people can be in there is if the 6-foot distancing requirements that they have to put in their plan can be met in the space that they have. So that's determining. And that number also includes all the vendors. And so as you consider a farmer's market, you know that there's generally a number of vendors. So those all count into that maximum. The governor on Thursday released that he's allowing gyms, fitness centers to be reopened on May 15th. And there are some specific requirements that were put forward in that directive. If you have questions about those, please call our number here at 258-4755. We have not added any requirements for gyms, nor have we delayed the opening. We do know that some gyms have contacted us. They'd like to phase in their reopening, and that's fine. That is their option. Another interesting call we've been getting is folks calling ahead to a restaurant or somewhere to make sure that all the requirements are in place, and they are, until they get there and find out that sometimes the servers are wearing the mask only over their mouth. So the mask has to cover mouth and nose in order to protect the other person, the people that you're serving and the people that you're working with. So nose and mouth, please. Other questions that we've had have to do with the 14-day quarantine. That is because of the governor's directive. He has kept in place the 14-day quarantine for anyone who is traveling into the state. So that doesn't matter if you're a Montana resident and you left the state and you come back in, you have a 14-day quarantine. If it's folks who are coming to Montana from, they live elsewhere and they're coming to visit or to spend their vacation time here, they have a 14-day quarantine before they can do that. So that is still in place. There are some exceptions for people working certain jobs that have to cross the border to do that. I'd also like to remind you of the large number of symptoms that can be related to COVID. We mostly think of the original symptoms, fever, cough, shortness of breath. However, a couple of weeks ago, the Centers for Disease Control, based on the evidence of the diseases and symptoms they've seen, extended that list. So anyone who has these following symptoms may be infected with COVID. They should at least contact their medical provider, and of course do that over the phone or with a telephonic or a video visit. They can also get a test. Their medical care provider may have them come into their establishment or send them somewhere for a test. If you don't have a medical care provider and you're interested in testing because you have one or some of these symptoms, you can come to the health department testing site at the fairgrounds. Just call 258-4770, press number 2, and you'll be screened by a nurse. Let me review the symptoms. Fever, shortness of breath, cough. Those are the 3 original ones that most people are familiar with. The following symptoms also could be indicative of COVID: sore throat, a new loss of smell or taste, shakes, chills, diarrhea, vomiting, and headache involved with any of these other symptoms. So keep those in mind. We have much more testing available now, and we really would like to test people early in the course of the infection if they have it, because that will help you, if you are infected, and everyone around you be protected from the contagion of that disease. And the contagiousness can happen without symptoms. It certainly happens with mild symptoms, and some of these symptoms that seem more common or they don't seem to be related to COVID-19. Well, they may be. The last thing I'd like to mention today is the Missoula newspaper has done an article. It was published yesterday, Sunday, and it has to do with some comparisons and some contrasts between how Missoula experienced the last huge pandemic that really caused the types of problems and concerns we have today, which was the 1918 influenza pandemic, with the experience we're going through today. And there's a couple takeaways from those comparisons. The first one is you don't really know what a pandemic's going to do until it's done it. Now, that said, that's why it's difficult for us to say, well, when is this going to open or when is that going to open? We really have to watch the epidemiological data. And watching that data is very difficult with this disease at first because we didn't have the testing. We also didn't know that some of these symptoms were related to COVID. Now we have better testing and we know that. And so don't wait till you're really sick. Unfortunately, back in 1918 with a completely different virus, it was an influenza virus, it hit people really, really fast. They sometimes were, deathly ill within a day or two. COVID gives us more time, is up to 14 days to find that disease and help you get treatment or care and to keep you from spreading it or other people spreading it to you. But unfortunately, fortunately for the person who has it, but for those of us looking for it, it's not as easy to identify that you may be sick and yet be contagious. So if you're interested in just generally understanding how Missoula coped with that back at that time and learning a little bit more about epidemic disease, that article may help you with that information. And that's all we have for today. We want to thank everyone who continues to call or write and provide us information or ask us for information. Have a good Monday. Thank you.